Hello and welcome to Frequently Asked Friday. Welcome back for those of our repeat viewers. Uh, Today we'll be talking about the delayed diagnosis and treatment of cancer, which unfortunately often happens with so many people. The two frequently asked questions that we often hear when it comes to the delayed diagnosis or when it comes to the diagnosis and treatment of cancer is how much does the treatment make a difference, number one? And number two, in the case of a delayed diagnosis, how the heck did my doctor miss it? The answer to both of these questions centers around the single most important factor in beating cancer, and that is early detection. The early detection of cancer is absolutely critical. And in fact, the early diagnosis and treatment of cancer is the single most important factor in survival and cure. So whenever you hear that early detection matters, that's the truth. Now, many people in the New York City area may have heard commercials for a major cancer center advertising for patients and saying that where you get treated matters the most. Well, I'm here to tell you that whether you get treated at Sloan Kettering, Sinai, Montefiore, or Maimonides does not matter nearly as much as when. The where, well, it might be helpful, is not nearly as important as when. The most critical factor to surviving a cancer diagnosis, to beating cancer and effecting a complete and total cure, the most critical factor is early detection and early treatment. When, not so much where. So how do you know if your doctor missed an opportunity for early detection? Well, today I'm going to talk with you about three different fact patterns that we see from time to time. One of them is going to be with respect to gastrointestinal tract cancer. One of them is going to be when you know you have a growth and they do a biopsy and it doesn't show. And the third will be with respect to mammogram and misdiagnosis of breast cancer. So here's the thing, when someone has early stage cancer, early or late stage cancer, in their GI tract, they may experience blood in their stool, or quite often they may experience no symptoms at all. In fact, sometimes healthcare providers and organized medicine like to call colon cancer the silent killer. And they call it the silent killer because you don't necessarily experience any symptoms. But just because you're not experiencing weight loss or abdominal pain or seeing blood in your stool does not mean that the evidence isn't there. In fact, that evidence is often there, and in that regard, you have to think about what happens as a cancer begins to grow and develop. As a small cancerous tumor begins to grow and develop, starting out as a series or a small group of cells, and then grows and grows and grows. It may not cause symptoms until there's a couple of million cells. It won't even be a 1 centimeter lesion until there's a billion cells. But as it gets bigger, even maybe a millimeter, and still very early and very curable, it will start growing into small microscopic blood vessels. And as it does so, it's going to cause bleeding. Now, sometimes you see that bleeding, but more often than not, that blood in your colon or if it's in your higher up in your GI tract, in your small intestine or your stomach, more often than not, that blood gets mixed in with the stool before you go to the bathroom, so you don't see it and you don't know. So that's why sometimes people call it a silent killer, because you don't have symptoms that you would see or experience. But as I said, the evidence may still be there. And the answer is on your annual blood test. If your doctor does an annual blood test, it should pick this up. It should pick this up because as you have a slow and small but chronic bleed caused by a small and early but growing cancer, it's going to grow into those blood vessels and cause anemia. And that will be seen on a lower or a lowering, a trend of going down with your red blood count, your hemoglobin, your hematocrit, and sometimes other things like the size of the blood cells and things like that that can be detected on a simple, everyday, annual screening blood test. So go for those blood tests because those blood tests are critically important. They give you all kinds of information about what's going on in your body, and they can, in these types of circumstances, be the difference between life and death. So sometimes, unfortunately, people come to us and say, "Oh, I had abdominal pain, and I was reporting to my doctor 3 or 4 times over a period of 1 month, and the doctor didn't do anything until a month. It took a month to get the thing diagnosed." That last month might not be the difference maker. By the time there was abdominal pain, the cancer may well have already been advanced. The die already may have been cast. However, we look at those records and go backwards and say, wait, what was going on? What was the trend with the red count hemoglobin and hematocrit? And very often we find that the warning signs were there, yet those warning signs were overlooked, unfortunately. The one other thing I would say about this type of thing is the concept, and this is the second area now, often with colon cancer or GI tract cancer, but it can happen with breast cancer, it can happen with any cancer, is the concept of how a biopsy is done and the concept of random sampling. So what does random sampling mean? When you do a biopsy, and sometimes sadly we're fighting a couple cases like this right now, you have, let's say there's a cancerous tumor, and I'm making it big enough to be seen on the screen right now, but if it was this big, it would be pretty bad. If the doctor takes just 1 or 2 little biopsies from the very edge of the tumor, they may miss it. That might be the cells that are becoming cancerous but are not yet fully malignant. It's critical for a doctor to take random sampling, so from different spots, maybe 6 or 8 different biopsies of that mass to see if there is any cancer in it, because otherwise you could know you have a tumor, you could have a symptom of that tumor or that mass. The doctor could send you for the right test, and merely because the biopsies aren't adequately done, adequately in number, or sometimes, unfortunately, misread by the pathologist, it can be missed. The third area I want to talk about is particularly with breast cancer and mammogram. And the first and most important thing I can tell people, particularly the women in our audience, is go for your annual mammograms. Breast cancer has become largely curable and has a north of 90% cure rate if it's caught when it's stage 1. And it's very catchable at stage 1. The technology is such with mammograms that they can detect 1 centimeter and sub 1 centimeter masses. When there's anything on that mammogram, be sure to go for the follow-up biopsy and see the breast surgeon specialist as well. Now, how does this go wrong sometimes? Well, sometimes the mammograms are misread. Sometimes the doctor puts in the report that something needs to be done, that the patient needs, the radiologist puts in the report that, back to the referring physician, that the patient needs a biopsy or needs to be seen by a breast surgeon for further review and evaluation, be seen by a specialist. And sometimes the referring doctor overlooks that. The report, they're sending dozens of patients for mammograms every month. The paperwork comes in, it gets mixed up with something else, and it's missed. That's how it can happen, but you can protect yourself. So here, I'm going to talk about how you can protect yourself here, and I'm going to talk about globally how you can protect yourself as a patient. But by law, the radiology facility must send you a copy of your mammogram report. That's by law. So if you don't get it, call them and tell them, send me my radiology report, send me my mammogram report. When you do get it, read it. Because there's nothing wrong with checking the work of your doctor. In fact, that's what you have to do to be doing your due diligence as a patient. It's rare that a doctor misfiles a document, but it can happen. And if there's a mass seen there, if there's a recommendation to see a breast surgeon, if there's a recommendation for a biopsy, talk to your doctor and advocate for yourself to make sure that this doesn't happen to you. We're here for you if God forbid it does, but I'd rather know that all of our clients and friends and family members and followers are getting quality health care. I'd rather see you at your next birthday than see you in my waiting room. So what can we do to prevent this? Well, we just talked about asking for the results. That goes for x-rays. And we've seen gosh knows how many cases where an x-ray picked up a mass in a patient's lung, and the screening x-ray for pre-surgical, they just cleared the person for surgery because their heart looked good, and didn't notice that there was a lesion in the lung. Ask for copies of the results. Ask for copies of the mammogram, which we talked about before, and ask for copies of the blood work. Now, you might say, how will I know if my hemoglobin or hematocrit or red blood count is abnormal? How am I going to know? It's actually really easy, believe it or not, because unlike 30 or 40 years ago where you had to remember what the range of normal was for hemoglobin or hematocrit or red count, they actually give it to you. They give you the results, they give you two columns, normal, and all your results should be down that normal column, and then they give you another column labeled abnormal. And if there's a number in the abnormal column, ask a question. I myself have had an abnormal value once or twice, and you ask a question, and my doctor said, well, your other 5 values that would tell me about X, Y, or Z are normal. I once had a measurement of something that was 1 millimeter over the upper limit of normal, and I was nervous, and my initial doctor said it was something to be concerned about. And I saw the specialist. I followed up, and the specialist came in and laughed at me and said, that 1/10, that 1 millimeter that is above the upper limit of normal is like less than 2 or 3% off the norm. And then he looked at me, and if you know me, I'm 6 feet 5 inches tall. He said, you're more than 10% above the norm. I'm not worried about that 1 millimeter. And it was okay. But you have to ask the questions, and you have to follow up. If it's not, by the way, some blood tests don't give you the 2 columns. That's okay, because almost every single one, if they don't give you the 2 columns, they put the abnormal values in boldface with an asterisk. You really can't miss it. But if you don't look, and you're that 1 in 100 or 1 in 1,000 that gets misfiled or overlooked, you don't want to be a statistic. You want to advocate for yourself, and you want to ask questions. We always get asked, why would I question my healthcare providers? Because things get overlooked. There's a reason why we at this firm have been doing medical negligence for over 30 years. So ask questions, be an advocate for yourself, and God forbid if you or a loved one has been diagnosed with advanced stage cancer and you're questioning whether the diagnosis should or could have been made earlier, give us a call. That's what we're here for. We're here for you. And if you have questions, we'll have the answers. Thanks for joining us this week, and please remember to join us next week when my sister and partner, John Bonina, will be answering all your questions concerning what you need to know to protect yourself, your home, and your family in terms of insurance needs and insurance requirements. Thank you once again for joining us, and have a great day.